And now it's time for health news. If you find that you're experiencing numbness or maybe tingling in your hands and feet, you may suffer from neuropathy. Here to explain what that is and how it can be treated is Dr. Joe Maher of Arizona Health Pros. Good to see you. Thanks for coming on.
Good to see you. Thank you.
I think this affects a lot of people, but maybe they don't know the term neuropathy. What is neuropathy?
Well, to really understand neuropathy best, you need to kind of take a look at the anatomy of a nerve cell. A nerve cell is made up of a cell body, but extending from the cell body is what's called an axon. And the axon is actually surrounded by what's called a myelin sheath. And the purpose of the myelin sheath is to speed up the flow of the nerve signal. And then also it's to kind of contain it. So what happens with neuropathy is the myelin sheath actually starts to break down. And so as a result of that breakdown of the myelin sheath, the nerve flow slows down, and it's also allowed to dissipate out from the axon.
What causes neuropathy?
Well, there's actually several different things that'll cause it. I'll try to name a few of them, but the #1 cause of neuropathy is diabetes. And as a matter of fact, 50% of diabetics will get neuropathy at some point.
Wow, and a lot of other causes too.
Yeah, definitely. There's things like cancer and tumors, things like that, cancer treatment, radiation, chemotherapy. There's connective tissue diseases like lupus or rheumatoid arthritis. There's also infectious diseases like Lyme disease, HIV, AIDS, hepatitis B. And also, interestingly enough, injuries and trauma can cause that as well. There's some conditions that happen in the wrist and in the feet, carpal tunnel syndrome, tarsal tunnel syndrome, and then as well as in the spine itself from bulging discs as well as spine degeneration.
Well, you can see all the causes, so it does affect a lot of people. Now, you hear the symptoms of neuropathy and it's like tingling of the hands and feet.
Yeah, those are the common ones. Most of our patients present with symptoms like that: numbness, tingling, sharp pain, burning pain, pins and needles, kind of a creepy crawly kind of a feeling, weakness in their arms or their legs, and also very commonly they have a loss of balance or a loss of coordination.
And this can be quite serious.
Very serious.
And really painful and irritating. Let's talk about your treatment and what Arizona Health Pros do. How do you guys differ from maybe other types of neuropathy treatment?
Well, some of the other types of treatment that I'm aware of primarily is going to be from oral medications. Medications like Cymbalta or Lyrica, which oddly enough, side effects of those two drugs can actually cause neuropathy.
Oh, wow.
As well as gabapentin is one of the more common drugs that we're aware of out there. But also there's other procedures like nerve blocks in the spine, other procedures like surgically implanted nerve stimulation, which sounds pretty serious to me.
Yeah, definitely.
Yeah, so lots of different things out there, but what makes our treatment a little bit different, and actually what our entire goal is to try to help our patients get off of those medications and to try to avoid those kinds of procedures. And the way that we do that is we start out with a very thorough examination. We also do our own diagnostic testing, which includes nerve conduction velocity testing, where we can actually test the speed of the nerve to determine the state that it's in at that point. Then we can start out with a trial period of our treatment, which basically consists of non-steroidal injections in the area where the pain is to try to help manage the pain. At the same time, we have various therapy techniques that we use that are very effective at increasing blood flow, decreasing inflammation and swelling, and we also use some nerve stimulation and things like that.
And I know you've seen great success with that. For people watching going, well, I want to try that, I want to see that success, what about payment? Does insurance pay for any of these treatments?
Absolutely it does. Medicare pays for it. And if you happen to have a Medicare HMO, sometimes that requires a referral from your primary care physician. We take some access plans, and again, sometimes that requires a referral from your primary care physician. But we also take all major medical. And one of the services that we provide is where we'll actually pre-verify insurance benefits and try to find out for you whether or not
Excellent.
that requires a referral and those kinds of things to make it easier.
All right, thanks a lot. We learned a lot today. Appreciate you coming on.
Well, thank you.
All right, and everyone, for more information, it's really simple. All you have to do is go to ArizonaHealthPros.com or just call the number on your screen.